Hello viewers, welcome once again on my YouTube channel, and I hope you guys are enjoying your weekend and spending a very good time with your family. Today I am going to discuss a very interesting and very important topic, is how to prepare for MRCP 1 exam. I have received so many messages in the last few years about preparation for MRCP 1. I also published my post for MRCP 1, how I did MRCP 1, 2 and PACES. It went viral. It's available on my forums. You can go and browse that as well. Now, why I selected this topic, it's a very popular exam, and it's a very tough exam. It's not really very easy. So every doctor anywhere in the world at some point in their life, they think about getting a membership of any royal colleges. So it's a very popular exam, and it's inexpensive as well, especially for those who are living in the third world country or developing world. For them, spending £600, £700 is not really very easy. So I thought I should come up with the comprehensive plan about your how to prepare for MRCP 1. Number of times I've seen people, they share their experiences on various forums that I passed in 3.5 months, I passed in 2.5 months, and this is what I did. So let me tell you that every person has his own individual experience and their own academic background. So you cannot copy paste their methodology in terms of how quickly they pass the exam, and it will not guarantee that you will, if you do the same, you will have the same result. So first of all, I will discuss what are the common mistakes people make. What is the biggest mistake a student make while you are preparing for MRCP exam? The biggest mistake is they try to copy someone else. So all of a sudden you will see one of the group member in your from your class, oh, someone has passed MRCP, and he will say, oh, I passed in 1.5 month, 2.5 month, and you, in your subconscious, you start thinking, oh, if he can pass, I can do that, and then you make a decision that I will do the exam. So don't copy someone else, and do not impulsively book the exam, which is really very important. Now, second mistakes people make is once they book the exam, they start walking other way around. They start walking in opposite direction, which is the second biggest mistake people do. Now, what do I mean by talking in opposite direction? You will find out by the end of this video what is the opposite direction. Most commonly people do is they start preparing from online resources. They start booking subscriptions and buying subscription, and I see number of posts talking about, can I have this medicine, past test, or there are various resources, and then they start reading that without realizing. They just read someone's experience that, oh, I did in 2.5 months, all you need is past medicine, past test, and you're done. Just sit and think in your mind that, is it possible to do MRCP by doing just 2,500 MCQs? Can it be done? So I know on the resources there are 2,000 or 2,500 MCQs, isn't it? So if you do 300 MCQs, maybe 100 MCQs in 3 hours per day, it means in 1 month you've done 3,000 MCQs. Now you're ready for MRCP. It doesn't work like that. This is the reason why people buy subscriptions, they do exam, they fail, they buy, they do, they fail. And this is a very common phenomena. So this is what I call you're walking in opposite direction. You need to set your direction first. You need to assess where do you stand and how to go forward. Okay. Now, if I say, I published my experience that I passed MRCP in 2.5 months, but my experience was different in terms that I already did USMLE before that. I already did MRCCS before that. I already was working in UK. I was already, I did the FCPS, and so you cannot compare my preparation with yours. So just say if you are a general final year medical student who has just graduated, or you have just done the house job, or you are an old graduate with a very blurry kind of academic background, how you should start, what should be your approach. So I have written it in various steps. So first of all, you have to decide, are you a suitable candidate to do the exam? Assess yourself, look your circumstances, where are you, what your financial background, can your family cope, or all those things. So put yourself in that frame. Are you the suitable candidate or not? Number one. Number two, once you have decided that you have to do the exam, now you have to assess yourself where you are actually standing. What's your ground? Where are you? And how long will it take? So don't book exam. Now, the best way to do your self assess is maybe you can do one mock and find out what your results are. So, and see how struggling it was for you. Are these questions completely new for you? What are they talking about? Is it just going away from your head, or you are able to work out and you have confusion in one or two stems, but you can still figure out what's going on? So you will find out where do you stand. Now, once you realize that okay, you are, remember, there will be some candidates who are exceptionally good, who are in the top 10, 20 in the class. Their academic background is great. They can do the targeted preparation, and then they can do the mocks and they can pass. But I'm doing this video is mainly to do the comprehensive, how to comprehensively prepare for MRCP. So first, do the research. Decide and do the research. In research, you assess yourself, and then you get registered with the various forums. Go on Facebook, go on Google, and see where are the various forums, and try and silently observe what is this exam, what they expect from you, what are the themes, what are the questions. So you will get a general idea about what is the expectation from you, without even telling anyone, without any discussion with anyone that you are going to do the exam. Just do a bit of research. Just get yourself registered with all the forums and see what talks are happening. Now, once you have done that, you will realize within a month of research that where you stand. Assuming that you have no grounds, you just did the medicine and you were an average student, how to divide the preparation for MRCP now. So start your preparation with the core stuff. So let's do this stepwise. Number one, you did the decision, you made the research. Now you have to start the preparation. So I divide the preparation basically in 3 or 4 steps. One is the core preparation. So do not go with this impression that you will do the past test, past medicine, and you will pass the exam. This is the biggest blunder you will make. You will lose money, you will lose the confidence, which is way more a bigger loss than anything else. So now, simple thing, start the core preparation. What is core preparation? So if you are not a very good student in your medical school, you need to go back to your books again. Go and see which books you studied first. Maybe whatever medicine book you studied, whatever pathology books you studied, just go and browse them again, because you already spent 5 years on these books. So it's easier for you to whatever you written, whatever you marked, it's easy to recap. Even if it is a review book, just go for it and just do a big brainstorming, what you studied. You will be surprised. I was just doing a very senior level gastroenterology exam last week, which is a consultant post exam here, and still they were asking, is the Peutz-Jeghers syndrome is an autosomal dominant or recessive? Isn't it surprising? They were asking, what is the cause of the Lyme disease? Is it Borrelia or what? So what I'm trying to say, that you will still be asked a very basic question. So go back to your physiology, anatomy, pathology. Just do a comprehensive review of your 4 or 5 years, whatever you did, to build up your core knowledge. It shouldn't take more than a month. Now once you have done the core studies, now you are going to do the targeted studies. Targeted studies for every single exam is very different. What is a targeted study? Now, when you go and sit on the forum, you will come across that, okay, if you read this book, there are so many books, I can't get you the name of all of them. There's notes and notes, there's Al-Maghribi notes, there are past test notes, revision notes. This is called targeted study. So you can select any of them, because now they will be talking about targeted MRCP studies. This includes Oxford Handbook of Oxford Handbook of Medicine. So once you've done the core studies, you have to go towards the targeted studies. You shouldn't spend more than 2 months on targeted studies. Take a good long time, read all modules, all stuff. And targeted studies, I say that Philip Carda is a good book. You can read that book, because there will be people who will say, oh, don't read about these books, because they are very clever. They already have a very good knowledge, and they just pass because of past medicine, past tests, or these. They still don't realize that what is your lacking. If you want to be 100% sure, prepare your exams in a way that when you go for the exam, you should be 100% sure that you should pass. There should not be any if and or but, that oh, can I fail, or what is my score. So you started with a targeted preparation, spend 1 month, 2 months, depends, what your previous level is. Do the stuff which you left in medicine. I was studying in Pakistan, and I remember one of the despite I was a very good student, and we were very studious, in final year Viva, one of the examiner asked SLE. And remember, everyone, I still remember all the candidates after those who were going for the same exam, they started panicking. Oh, this examiner is asking SLE. Oh my God, we didn't prepare. Because in Pakistan, we do targeted studies, isn't it? We do malaria, typhoid, cholera, TB. As soon as examiner asks something else, we get panic. So start highlighting those topics which are very heavily tested in MRCP exam, but you left it. Rheumatology, renal, endocrine, calcium metabolism, vitamin B12, all those things are really very heavily tested. On one day I will make a video on high yield topics for MRCP1, what you should actually study for the targeted study. So once you've done the core studies, second step is targeted studies. You have to go through the books, what is expected from you. Now the third step is important one. You go to the online resources. You have to spend 1 month or 2 months on MRCP, all those. Either you go for past test, you go for past medicine. Both are equally good, equally rated, or on examination. It really doesn't matter. But don't go through their hard copies. Go through the real subscriptions, because that real subscription actually gives you your percentage, your performances, and they identify your weak areas, your hard areas, and then they accumulate your results and give it to you. So which will be a big positive impulse for you. So try and the third step is do the MCQs. Now people start their preparation from last step, isn't it? Which is wrong. Don't do that. Once you have done the third step, now is your own bullet points. What was your understanding from whole research, your journey, that you started from core studies, you went through targeted studies, you bought all the books, you went through all the MCQs. Now you made your own mind, what is my understanding of that. So start making your bullet points. Open your journal register, just write, okay, this is sarcoidosis, chest, bilateral, hilar lymphadenopathy, ACE inhibitor level, can cause facial nerve palsy, just make a bullet points of each of them in one line. Don't write too much. That bullet points are actually your asset. You take that while you're traveling, you're walking, and then when you go for exam, trust me, 100% of exam will be expected. 100% of exam will be from what you read, you went through it. There's no way you can fail. There's no way. This is how I prepare for exam. This is how I go for my exam. That because I've spent a good long time already on my core studies, so I don't have to spend that much time on the core studies. I do targeted studies now, and then I do the MCQs. This is the reason why in 2.5 months, 3 months, I pass any difficult exam. I hope this was useful for you. Utilize your traveling time. I remember when I was doing my MRCP exam, I was traveling 1.5 hours. So I was doing 50 MCQs while I was going in the train and 50 MCQs while I was coming in the train. So I was doing 100 MCQs, and in 1 month, 1.5 months, I did 3,000 MCQs. So and then I passed. So I hope this was useful. Try and make your approach in stepwise, and make your bullet points. The last part is that if you get an opportunity after your full preparation, spend 15 days in teaching someone. Grab someone. Okay, yeah, let's discuss, or sit with your friend and just go through it again. In 5 months, 6 months, you can crack any membership exam. You just sit this way. There's no way you can fail. Thank you very much for listening me, and very soon I will be bringing up more stuff, which includes MRCP2 preparation, resources, PACES, how to do PACES, and I will be talking more about your how to study actually, what is the way to study the disease. I hope this was useful. Thank you very much, and stay connected with my channel. Subscribe now and join me, and give your feedback about this video. Share with your colleagues. Thank you very much. Dr. Ash from London.